Moving forward, as we are celebrating the Foundation Day of Icar-Nivedi, most of our new members may not be much aware about the genesis of the institute. So now may I request our director, sir, Dr. B.R. Gulati, sir, to brief about the journey of Icar-Nivedi.
Namaskar, good morning. On this occasion of the Foundation Day of Icar-Nivedi, I welcome you all here. Dignitaries on the dais, my dear friend and the respected Honorable Assistant Director General Animal Health, ICR, Dr. Ashok Kumarji, the Chief Guest of the function, the Guest of Honors, Dr. T.K. Behera, Dr. Sahu, Dr. Paligar, Dr. Sushil, Dr. Venkat Subramaniam, Dr. Ramamurthy, Dr. B.S. Mahesh, Dr. B.R. Shom, Dr. B.K. Singh, and the guest of honors of this occasion, the farmers coming from different part of Karnataka and joining us in this celebration. I welcome you all here, and my scientists, my fellow colleagues, this talk, and it is a great moment for me and for Nivedi that we have galaxy of invited guests here in this small auditorium, so-called auditorium or the evening hall. And I appreciate that all the directors of the ICR institutes and dignitaries accepted our invitation and joined us in this organization of the Foundation Day celebration. Thank you very much for coming. In fact, can I have my presentation? As Dr. Rajesh Sham, the program coordinator, pointed out, the journey of Icar-Nivedi began in 1987 with the establishment of one research project called the All India Coordinated Research Project on Disease Monitoring and Surveillance. And subsequently, this journey culminated into 2013 establishment of a full National Institute of Veterinary Epidemiology and Disease Informatics with the mandate of doing research on livestock disease, epidemiology, informatics, and economics, and also working on surveillance, monitoring, forecasting, and forewarning of livestock diseases, and also developing capacity building and repository in these areas of epidemiology and disease informatics. So we are working for this nation with our motto line, the transforming animal health through information and innovation. So 1987, this was one project with few partners in this project as All India Coordinated Research Project. And based on our contribution, especially in the control of rinderpest and also in managing many diseases across the country, the ICR recognized our contribution, established, converted this project into a project directorate on disease monitoring and surveillance. This PD ADMAS continue to outperform many ICR project directorate and then subsequently giving recognition to those contributions. And those contributions were because of all the predecessors and founders, directors of Nivedi or the PD ADMAS. I would like to give this special mention to our earlier Dr. M. Rajeshekar, who was the founder director or the AICRP and subsequently PD ADMAS. I regret that he could not join because of his ill health. He is unable to move and speak and communicate. But his well wishes are always with this institution. I recognize his contribution. Subsequently, Dr. Prabhu Das, and then followed by Dr. Rahman. Dr. Rahman has played significant role in the establishment of these institutions in the form of Nivedi. When he joined, it was the project directorate at Mars, and subsequently during his tenure, this was promoted to the institute. And because of his contributions, this new campus, here we were in Apple campus, because of his contribution, this campus, beautiful campus where we are sitting now, was his contributions. And not only that, following that, we have been building on those strengths provided by our leaders. Subsequently, Dr. Parimal Rai and Dr. B.R. Shaw, they have contributed in this journey. And I would like to thank Dr. B.R. Shaw, who is here. He has been associated in building this institution from PD Admas and subsequently Nivedi, and it brought it to such a platform where this institute can achieve the national and international milestones. So I thank all those people who have contributed in this journey. Thank you very much, sir. And Dr. Shom is here. I must appreciate your contribution in this institution. Can I have the next slide? So this institution is primarily working on the livestock disease surveillance and monitoring. This surveillance and monitoring we are doing not only in Karnataka, but in the entire country. We are connected with each and every district of the entire country, each and every block of the entire country for livestock disease surveillance and monitoring. For this surveillance monitoring, we are also involved in development of diagnostics and population assays for screening of livestock disease. Then we are also working on epidemiology. Whenever importance of epidemiology has been highlighted since the pandemic of COVID-19 came. But this institution has been recognized, making significant contribution in livestock epidemiology and outbreak investigations, and we have been the leader in the country in that direction. Then we are also not only working on livestock diseases, we are also working on zoonotic diseases, the diseases which are transmitted from animals to human beings. Also, we are working on antimicrobial resistance, and we also work on the risk assessment, disease modeling, predictive analytics, forecasting, forewarning, and risk communication. We communicate the risk of disease up to all stakeholders, even to the livestock owners. This communication on every month we are sending communication to the farmers also, so that they can take necessary steps to prevent the spread of the diseases, and they can also safeguard their livestock. Then we are also working on socio-economic impact of livestock diseases. This is one area very important. We are estimating the burden of livestock diseases so that the policymakers can make decisions based on the economic importance of the livestock diseases. Can I have the next slide? So we are doing this surveillance of livestock diseases, as I said, in all more than 700 districts of the country, and up to block level we are getting the information on month-on-month basis. And these are continuous efforts. For last 20 years, we are getting the data, and longitudinal data is available with us to make the trend of the disease. And we can also say what is the status of disease in 2030 or 2047 based on these kind of data that we are collecting. Next. So for doing these kind of studies across the country, we are making the strategies. We cannot screen each and every animal. There are 538 million animals in the country. So we make these stratified sampling plans. And it is only Nivedi Institute whose sampling plans are accepted nationally. DHD depends upon Nivedi for doing all the control programs in the country, for doing the surveillance and monitoring of livestock diseases, or even for measuring the impact of national vaccination programs like foot and mouth disease, brucellosis, CSF, PPR. All these sampling plans are provided by Nivedi. Next. So whenever there is some disease outbreak, like lumpy skin disease in cattle came in 2019, it was a devastating disease. As Dr. Matpalagar sir, Director of Karnataka is there, he knows how devastating it was to the live cattle, cows specifically. And when we are celebrating, honoring the cow as a the holy animal, and dying because of lumpy skin disease. There also Nivedi plays a critical role in managing the disease, providing the necessary support to all the state animal husbandry departments and also to the DHD government of India. Necessary inputs for how to manage and control this disease were provided by Nivedi. It was based on Nivedi's inputs that government of India decided to go for annual booster vaccination for next 3 years. So these inputs we provide to the government of India, they implement that. Next. Similarly, African swine fever came in pigs. Those who are connected with Northeast or even in Karnataka and Kerala, pigs are important driver of economy. Pigs were dying in 2020, 21, 22 because of this. This disease, there is no vaccine, no treatment, and if this disease comes, 100% deaths. All the pigs die. So Nivedi provided necessary support for risk assessment and also provided inputs for managing this disease by biosecurity and biosafety measures. And now this disease is also under control. Next. Similarly, we are, as I said, continuously monitoring the livestock diseases. And whenever there is a vaccination program going on in the country, we also provide the input. What is the impact of vaccination? Whether after vaccination, there is herd immunity, population immunity development or not, number of cases, number of outbreaks coming down or not. These kinds of inputs are provided by Nivedi to Government of India. And based on these inputs, they revise their strategies. They take necessary course action so that disease could be eradicated. One disease that is called PPR or sheep and goat plague. Nivedi, Government of India is targeting eradicating this disease by 2030. So mass vaccination is going on in the country, and Nivedi is monitoring this disease. Whether cases occurring in country, they are coming down or not, vaccination effective or not. These kind of inputs are regularly provided by Nivedi. And for this, we are getting more than 150,000 samples every year from entire country, which are being tested here. And then we provide the reports to all the stakeholders. Next. Similarly, nowadays we are talking about genomic surveillance and environment surveillance. We are talking now when this COVID-19 came. But Nivedi was already into it. We were doing the genomic surveillance of important livestock diseases like blue tongue virus and many more diseases. And we were telling which are the genotypes prevalent in with each state so that vaccination can be modified, upgraded accordingly. Next. And we are also developing the assays for diagnosis of livestock diseases. For many important livestock diseases, we have developed diagnostic assays, including Madam Rajesh Trisham is making, or for many other diseases, classical swine fever, PPR, leptospirosis, and many more. And these diagnostic assays are for screening the population, not for one animal, for the population screening. We are developing the assays and are very useful for control programs. Next. Then we are also nowadays we are talking one health all the time. So Nivedi has taken lead in that also. We are doing into one health, and we do working on a lot of zoonotic disease. We are also working on antimicrobial resistance, not only in livestock but also the livestock handlers and also the livestock environment. And we are also now working how much is the antimicrobial usage happening in the livestock. Because every time the media or the people talk, the livestock is contributing to the antimicrobial resistance in the population. So there are sometimes no facts available. The consumption of antibiotic is more in human sector, less in livestock sector, little bit more in poultry sector, but still we are working on the data. What is the role of antimicrobial uses? What is the level of antimicrobial uses in different areas of the country? So this is one area we are working. So for that, we are also working in collaboration with many agencies, nationally as well as internationally. We have project on One Health from NCDC. We have project from Indian Council of Medical Research. We have project from Department of Biotechnology. We have also collaboration with other institutions like Indian Institute of Technology, Mumbai, And we are also international collaboration. We are having funding from Defense Threat Reduction Agency USA on One Health and threats we are working. Now we have also started working on zoonotic tuberculosis. Tuberculosis from Government of India is targeting eradication of tuberculosis. It is not possible without eradicating tuberculosis from the cattle or the livestock. So we have started one study on zoonotic tuberculosis with the Gates Foundation funding